Um, I would like to welcome everyone on this platform for the third meeting webinar on Install Africa. This is actually the third online sensitization program, and the other webinars, two webinars, has already passed. And this is concerned about innovation, science, and technology for action and the running in Africa, which is Install Africa, which aims to strengthen the research capacity with Drosophila in Rwanda. So today's webinar, we are very excited to get a topic on precision medicine, Drosophila for personalized cancer treatment, which will be presented by our speaker of today, who is Dr. Monsurah Gbadamosi, and will be welcomed later by Mrs. Ainas. So let me take this opportunity to welcome the special guest of honors in this seminar. I'd like to welcome the Principal of College of Medicine and Health Science, University of Rwanda, Professor Abraham, the Executive Secretary of National Council for Science and Technology, Dr. Eugene, the Director General of Rwanda Biomedical Center, Professor Claude Muvunyi, the DG of National Industrial Research and Development, Dr. Sekomo, the Director General of Rwanda and Food and Drug Agency, Professor Emir, and Professor of Human Genetic, College of Medicine and Health Science, UR, Professor Leo Mutesa. Welcome all of you, and feel free to ask questions when it is time for questions and contribute for this great webinar. I'd like to welcome Mrs. Ainas to give us a short introduction on our main speaker, so that we continue our webinar knowing who are we listening to, what is her background, and what can we ask and what can we contribute. Thank you very much. Mrs. Ainas, please. The floor is
Hello,
yours.
warm greetings. Hope you can hear me very well.
Yes.
Okay, this is briefing our great speaker, Dr. Monsurah Gbadamosi. I will give you a brief background of her professional process. She is an educational professional career began with earning her Bachelor of Technology degree in Human Anatomy from Ladoke Akitonola University of Technology in Nigeria in 2009. Her pursuit of knowledge led her to attaining an MSc in Human Anatomy from Ahmadu Bello University, Zaria in 2014, where she worked in collaboration with the pathology department at the teaching hospital. While working as a lecturer at Kampala International University, Ishaka, Uganda, Dr. Gbadamosi was introduced to the world of Drosophila in 2016. During her stay at the KIU, she benefited from the mentorship and guidance of the head of the Institute of Biomedical Research, Dr. Marta Vicente Crespo, who played a crucial role in her development. She immersed herself in the study of flies and neuromuscular disorders, gaining valuable insights into the intricacies of the disease. In 2017, Dr. Gbadamosi received the prestigious Arturo Flascia PhD Fellowship in recognition of her dedication and potential as a scientist. This opportunity led her to the esteemed International Center for Genetic Engineering and Biotechnology, headquarters in Trieste, Italy, where she pursued her doctoral studies. And during the neurobiology lab, Dr. Gbadamosi continued her exploration of flies, delving deep into the field. She is a co-founder of the DROS for Nigeria in 2018, an organization whose aims is to promote the use of Drosophila in schools and research in Nigeria. After years of diligent work, she achieved a significant milestone in 2021, graduating with a PhD in life sciences, specializing in neurobiology. Currently, Dr. Gbadamosi holds the position of senior scientist in the Fly Laboratory at Vivan Therapeutics in the United Kingdom. Her expertise and contributions continue to shape the realm of research, displaying her as an inspiring figure in her field. We welcome her abroad and warm greeting to all.
Thank you very much.
Thank
Doctor,
you.
the floor is yours.
Okay. Thank you, everyone. Good morning.
Good
Okay.
morning.
I'm trying to share my screen now.
Yeah, have you seen it?
Yes, can
Okay,
everyone see?
see it. You can
Huh?
see it like this. You can see it.
Yeah, but I'm having echo. Is it only on my side or it's fine for everyone else?
It's fine over here.
It's
Okay.
fine.
Okay, but I'm having some echo. Anyway, I'll start since everyone can hear me. Okay, good morning, everyone. My name is Monsurah. I
Good
will
morning.
let's say the what I've prepared today. I have to say this before I start, so to make some clarification. What I've prepared today would be for informational purposes alone, and I'm trying to avoid going really deep into the science strategies that is involved in all of these processes because I do not want to complicate matters, and I want everyone in attendance today to have at least one take home. So, if we have some people in the audience that would like to talk more about the science, as in they want to go a bit deeper into the scientific strategies involved in all of this, I will be very glad and happy to talk about it later. Okay, so now we can start. What is precision medicine? If you ask me that, I would say precision medicine is just customized healthcare. Yeah, customized, targeted healthcare. The same concept of customization that we know. My name is Monserrat, but some of my friends call me GMT. So if I put GMT on my veil now, we say my veil is customized because it's for me. I put my name on it. We'd say I'm putting on a customized veil. Yeah, so the same concept is what precision medicine is all about, but for healthcare purposes. So when we say precision medicine, it's a sort of customized healthcare that tailors the medical treatment of a patient to the individual characteristics of that patient, taking into consideration the genetic makeup of the patient. And what is the aim of precision medicine? The aim is to provide a more effective, tailored course of treatment that is more efficient and with the ultimate goal of improving patient outcome. While we are improving patient outcome, precision medicine must also help to reduce the adverse effects of certain drugs. So that's what precision medicine is all about. Simply put, customized healthcare. You shouldn't forget that. Customized healthcare. That's what precision medicine is. Okay, up here. I can't Okay, yeah. Up here, we have the standard approach to treatment, which every patient usually go through, and some patients may not benefit from it. But down here, we have a precision medicine approach, which is a tailored approach. As you've seen, the patient has been sorted into their different categories, which will enable us to provide a more tailored treatment for them that will help them. So, for precision.
Excuse, uh, Doctor, I'm still seeing the first slide. I don't know if you are moving the slides or not.
I am moving.
Oh my God. Maybe you can put it in a presentation mode as well.
Yeah, it's in prison. Everyone cannot see.
Now
No?
I can see the third slide.
Yes, I'm on the third
Yeah.
slide now.
Maybe you can put in the presentation mode if you don't mind.
Can you see the fourth
Yes,
one
the third one now.
now?
Yes.
What number is the slide that you can see now, please?
Number three, on precision medicine, number three, with people, patients, treatment, standard approach, tailored approach.
Ah, okay. Because it's not moving as I'm moving it, which I don't know. Because now you should be on slide 5. I just moved it to slide 5, but you're still on the third slide, right?
Yeah, maybe it's my internet. I don't know on others.
Can you confirm if others are having the same issues, please?
Yes, yes. It's still on slide 3 with me here also.
Oh, okay.
Maybe
Let,
put on presentation mode.
I've always been in the presentation mode, but let me see. I'll stop sharing and then share again to see if it makes a difference.
Okay.
Now I'm going to start sharing. Okay.
How about I share this something for you?
Because I made some small changes, I will not be able to follow it from last night to now. Okay, I'm on the third slide now.
Yes, we can see it.
Okay, as I was saying, let's see what happens in the next slide. If not, then I have to go back again and put it on. I'll fix it anyway. So let's just continue. I said precision medicine. The first box here is the standard approach to healthcare that we all know. One size fits all for every patient. Let's say, but so as we've been discovering in recent times, this one size fits all does not help all patients. So precision medicine that is down here, you see that it has managed to sort the patient into their subcategories so that a more tailored approach can be given to them, can be offered to them so that they can benefit from the treatment approach, not just a one size fits all, where some patients may not, will end up not getting any benefits from the treatment. I'm on the fourth slide. Is it moving? Hello, anyone?
Now,
Oh
No.
no, the slide is not moving.
yes, it
Yes.
is on the fourth slide now. It's taking
Maybe
like,
stop sharing and share your full screen.
I think it takes
Because it's
over 4 seconds before it shows. So
So it's
Yeah.
we
on
just,
the fourth slide now.
okay.
Yes, yes.
Okay.
or
Yes,
we
Okay.
I
can see
can
it now.
see it.
So as I
I
was
can see it.
saying, precision medicine and ensures that every patient benefits from the treatment options that they are offered. You see, without precision medicine on the left, some patients will not benefit from the same therapy as others, and some will actually have adverse effects. But with precision medicine, every patient will benefit because we tailor precision medicine, we tailor the approach to the genetic composition of the patient and make sure that they all have a tailored approach to their treatments. So that's what precision medicine does. Okay, excuse me, please. For the purpose of this talk, I might be using precision medicine interchangeably with personalized medicine, but in reality, they are not 100%. They are not exactly the same 100%. So what do I mean? I would say precision medicine, let's say precision medicine takes into account the differences of patients and categorize them based on their biological makeup, their psychosocial factors, their clinical information. That's what precision medicine does. But personalized medicine will now take these differences and use it to implement a tailored approach to a tailored approach to treatment for this patient. I hope I'm clear. So technically, we can say personalized medicine is in precision medicine. Precision medicine would lead to personalized medicine. So that's their relationship. But for the purpose of this talk, I might use both of them interchangeably, just to make some clarifications. Okay, what are the features of precision medicine? How do we know that what is going on is called precision medicine? I'm on slide 7. Is everyone on slide 7? No?
Yes.
Yes,
Yes.
yes.
Okay, so it's moving now. First feature of precision medicine, genomic profiling. What does this mean? It means that for the first course of action, we sequence the patient genome. Why? To identify specific variations that could mitigate the disease that the patient is having. So genomic profiling is a first feature of precision medicine. Why? We need this, let's say precision medicine needs this to understand what is going on with the patient and to offer some preventive measures. Let's say like patient with BRCA1 mutations in BRCA1 and BRCA2 genes. You see these two genes, anybody that has a mutation in these two genes, they have a whooping 85% chance of coming down with breast cancer. And out of this, 60% of them will also come down with ovarian cancer. So you see, if you do this genomic profiling by the way of this genetic test, you'll be able to tell, as in you have a report that says you are predisposed to coming down with breast cancer later in life because you have mutation in this and in this. And then, if you know that already, I think a patient will be more open to, let's say, lifestyle changes that can help to reduce, or let's say to reduce to delay is the better word, to delay the onset of some diseases. And for cancer especially, early detection is very important because it helps to it gives a better fighting chance. So you see, genomic profiling is an important feature of precision medicine. Second one I'll talk about is targeted therapy. As I've been saying, precision medicine is not a one size fits all approach. It is a therapy that has a focus of target, because from the genomic profiling, we will understand the molecular mechanism underlying this particular disease that we are talking about for the patient. So if we are able to understand all the genetic, let's say, predisposition, genetic variability that can affect the development of this disease in the patient, we can target our therapies to specific areas of this disease, so that, like, an important backbone of the disease will be targeted, so that once that part of the disease is crippled, the disease will be solved. The treatment action will work. So that's what precision medicine would also help us to achieve. Targeted therapy, not just try and error. Let's try this. No, we know exactly where we are going and how to get there. Sure, personalized treatment plans, as I've said, precision medicine will lead to personalized treatment plans because the treatment plans will be highly individualized. We will take into account the genomic variability, the genomic composition of the patient, their psychosocial factors, their clinical information. Everything together will be used to develop um, an individualized treatment for them, and it's going to be unique for them, and it works for them alone. Data integration. As I've been saying, that precision medicine will rely a lot on data collection from a lot of places: genetic, clinical, environmental, all these data together, the integration of them and implementation of the direct integration of all these data is what will give us the result from precision medicine. So that's why data integration is an important feature of precision medicine, because all this data has to be integrated and analyzed by advanced computational tool, so that we will be able to get, let's say, a more robust course of action. Preventive care is an important part of precision medicine, because the focus of healthcare, we want to shift it away from reactive to preventive, because as we all know, prevention is better than cure. So if we are able to prevent some of these diseases, you know that you are predisposed to some of these diseases, it's easier and faster, and I think better for patients to prevent themselves from coming down to the disease rather than trying to cure the disease. So precision medicine will help to understand the patient genetic risks and offer some preventive diagnostic tools, and also some preventive lifestyle changes might just be sufficient to delay the onset of some diseases. So these benefits that I'm going to just run through is similar to what the previous slide is talking about, which are the features. It is from the features of precision medicine that we have drawn out some of the benefits. If the
Um,
slide is the slide moving now?
Please, would you allow me to share the slide? It will be on full screen here.
Not yet. We are waiting for some.
Okay, we can see it now.
Okay, now I know the trick now. I know the trick to get it to I don't know why, but that's what is happening. Anyway, so these benefits are from the features of the precision medicine, and it's something that I've been saying, so I'm going to reiterate it again. And a benefit of precision medicine is targeted treatment, personalized medicine. It will reduce side effects. Drugs will be tailored exactly to the patient need. A patient, because most patients, let's say patient with diabetes mellitus, asthma, some of these patients, the standard of care treatment that is available now does not help some people. I think there is a particular drug that they use for diabetes mellitus patients in the UK that people of black origin do not really benefit from. Why? Are we able to know this? Precision medicine. They managed to sequence the genome of some patients, and they've discovered some alterations in some genes that will prevent the action of these drugs. So they know that the first cut of treatment for black patients with type 2 diabetes mellitus would not be this particular drug. So targeted treatment is a good benefit of precision medicine. Improve diagnosis, especially for people with rare diseases. They are the ones that really suffer the brunt of trial and error, because they don't know. Physicians are not clear about the course of action to take for them, because their disease is so rare that some of them are misdiagnosed. But with precision medicine, genetic screening will allow improved diagnosis, so that the course of treatment they will get will be more effective, and some of them could even be preventive. So precision medicine has helped to improve our diagnostic tools. Predictive risk assessment, of course, something I've also talked about. Earlier detection of diseases will help significantly to improve the patient outcome. Enhanced drug development, it's like targeted therapies. When you know exactly what to do, where to go, the drugs, the let's say the job of the chemist is half done, because you know exactly the target that we are aiming for. So the drug that you're synthesizing will know exactly where it's supposed to work. the receptor could be a receptor protein or something, you know exactly where it's going to affect its plan. So this will enable researchers to improve on the treatment option by focusing their attention on a particular target of the disease. So yeah, it's also one of the benefits of precision medicine. One of them that I personally like is the patient engagement and empowerment, because the precision medicine kind of allow patients to have a say in how their healthcare treatment options are offered. You know, because you have doctors have to discuss with the patient, take their psychosocial information, their lifestyle habits, everything into consideration. You talk to the patient, you physicians have to explain to the patient, you know, let them understand what is going on. I think it's a more effective way of healthcare delivery, because when patients understand some things, they focus. Let's say they when they understand what is going on in them, you tell your patient that you are the tests I've carried out for you, some genetic screening that I've done on you, you are predisposed to developing diabetes mellitus later in life. So right now, I will advise you to go to watch your carbohydrate intake. I will prefer you to go on a low carb diet. You know, I think the patient will adhere to this more than just prescribing diabetes mellitus drugs later in life. So patients get empowered, they discuss, they are involved in how their treatment options or in how the doctors arrived at their treatment options. So I think this is of great benefit that will improve the patient outcomes. As sweet as this precision medicine is, we have some challenges and considerations that we have to take into effect before the whole precision medicine can say it has come to stay. I would say the first one is cost and accessibility. Sure, some genetic tests are very advanced and they are expensive and may not be accessible to all, but truly the cost of some of these genetics tests have been falling over the last couple of years. But I think the cost, what it will cost to fully implement all of these personalized treatment options might still be quite a lot in some part of the world, and how accessible is this treatment is something that we all have to consider. And also, because precision medicine have they rely heavily on the collection and analysis of large amounts of data, it raises the concern for privacy, you know, patient privacy. How do we ensure that there is security and confidentiality of patient data is something that will have to be discussed and considered. Some ethical and legal issues might also come up, because now that there is there is data sharing everywhere, because for precision medicine to work, large amount of data has to be shared. So people get to see that some people have certain genetic disposition to something, and then there could be the potential bias. People can be judged or characterized based on their genetic characteristics. So we don't want people to start discriminating because of genetic consideration. So these are guidelines. There are guidelines and regulations has to be in place to mitigate against this. And as I've said again, implementation of precision medicine into mainstream healthcare will require significant changes to clinical practice, because you have to train clinical personnel, you have to put in place some infrastructures, and this can be a daunting task. Sure, we still need further research and clinical trials to validate the efficacy of these approaches in healthcare system, and also we need them to replicate some of these approaches in other populations and other diseases, so that we have a more robust database to draw our inferences from. So, in conclusion, I would say precision medicine has come to stay, and it is the future of healthcare delivery, and it's shifting the paradigm of healthcare from reactive to preventive. And it has come to transform patient care. It offers more personalized treatment tailored specifically to. Okay. That's usually what I do, but I'll do it again. I don't know what's going on. Okay, if I share the entire screen, it's the full screen that I've been sharing anyway. That's it. Okay, are we all on slide number 10? Conclusion.
Yes, we can see it.
Yes.
Okay, as I was saying, I will conclude that precision medicine is the future of healthcare delivery. It has come to shift the paradigm of healthcare from reactive to preventive, and it is leveraging on the advances in genomics and all this data analysis and biotechnology to transform patient care. And the ultimate goal of precision medicine is to improve patient outcome and enhance the overall quality of life. So that's a quick overview of what precision medicine is all about. Now to the business of the day, exactly why we are here. What has Drosophila got to do with personalized cancer treatment? What has been done with Drosophila in the field of personalized medicine or precision medicine? That is what I've come to tell you today. But before I go into that, I'll just give you a quick recap about Drosophila melanogaster. I'm sure you've heard about it before, so I'll be quite fast about it. Drosophila is an invertebrate with a long history in biological research. It has been used for research since the 1900s. The life cycle of Drosophila takes about 10 days at 25 degrees. If you increase the temperature, the life cycle is faster. It could be, let's say, about 8 days. If you put the temperature to about 28, 29, it can take less than 10 days. But if you reduce the temperature to, let's say, 18 degrees, the life cycle will also increase to about, let's say, 15, 16 days. So, yeah, excuse me. Drosophila, and there is a sexual dimorphism in Drosophila. The female and male, they are similar, but they are not exactly the same. There are sexual differences, and every female can lay up to 400 to 500 eggs per day. So you see, it's very easy to culture and maintain a Drosophila colony, and it's easier, faster, and cheaper. That is in comparison to other model organisms. I can't imagine one rat or one mice giving birth to 500 liters. It's almost impossible. It's almost impossible for me to imagine. But for flies, you can have millions of flies in a relatively small space, and to take care of them is not so expensive. What we give them, the food that we give flies, that is made from agar, sucrose, cornmeal. So it's not, so they are ingredients that are not expensive in the relative cost of stuff. It's not that expensive if you compare it. So it's cheaper to maintain a colony of Drosophila. And important to this discussion is the fact that Drosophila has a very compact genome. I will explain. Because human beings have 22 pairs of chromosome and one pair of sex chromosome, making 23 pairs in all. Drosophila has four pairs of chromosome, and of these four, one pair is the sex chromosome. So Drosophila has three chromosomes for manipulation. The fourth chromosome is very small and it contains very few genes, so we rarely use that. So essentially, Drosophila has two, the second and third chromosome that is being used for manipulation. So out of this, 70% of disease-causing genes in humans that have a whopping 22 pairs of chromosome 70% of disease-causing genes in the genome of human beings is present as a functional autolog in the fly that has just two pairs. So you see the genome of Drosophila melanogaster is very compact, and that is particularly useful to us. And you see, also in the fly, we have the numerous genetic and molecular tools that are available for various manipulation. One of them is the US GAL4 system. The US system is used to, let's say, upregulate genes. We have the RNAi system. The RNAi system essentially is used to downregulate gene expression. And we have let's say, the GAL4 GALA TTS system. This system is used essentially to regulate gene expression. So we have some balancers. There are a lot of genetic manipulations that we can do with Drosophila melanogaster because these tools are available. So what do we do with it? The story of Drosophila melanogaster in personalized cancer research cannot be told without Vivan Therapeutics. What is Vivan Therapeutics? That is the trade name for the biotechnology company called My Personal Therapeutics. The technology that we use at Vivan Therapeutics to offer personalized cancer treatment to patients was developed at the Icahn School of Medicine in Mount Sinai in New York over decades of academic and clinical research. How? Why? Clinicians over there discovered that their patients, the tumors of their patients, are resistant to single drug treatment. Why? Because these tumors, these patients have mutations in many genes, and some of these genes are not even directly cancer related. But in the genome of this patient, they have some other mutations that they think will mitigate this tumor that they have. So they started this research. And of importance, I think of importance is this research that was done in Professor Ross Kagan's lab, and this was when he discovered the new combination drugs for a patient that has a form of salivary gland cancer that is resistant to standard of care drug treatment. So in his lab, he was able to find, let's say, a cocktail of drugs that helped this patient that his tumor has been resistant to all the drugs. And this drug combination that they got was a combination of trimetinib and two other drugs. And these drugs are not even cytotoxic. You know, cancer drugs are notorious for being cytotoxic. So this this was what started the therapy, the process that Vivan Therapeutics called personal discovery process. This is where the technology started from. So essentially, what we do at Vivan Therapeutics is replicate this, but on a large scale. So this process has been licensed exclusively to My Personal Therapeutics. So what is PDP process? Personal discovery process. Also, is an innovative strategy that produces treatment recommendations fully tailored to individual tumors. The PDP process of Vivan Therapeutics finds drug combinations that capture the entire oncogenic map of the patient. How do we do this? Okay, so we have, let's say we've got one patient. What do we do to the patient that has this tumor? The first step is to sequence the whole genome of the patient. So we sequence the entirety of the tumor so that we get the tumor mutation, the entirety of the genome, so that we get the tumor mutations and the network, everything together. So once we get the mutations, once we get the genes that are altered in this patient, we engineer these mutations into the Drosophila. So we have genetic tools that we use that I've explained earlier to put these genes, these mutations into Drosophila. So essentially, every patient has a Drosophila avatar. And then this avatar, we use all the FDA approved drugs. We screen all the FDA approved drugs using this avatar. that has been developed especially for uniquely for that patient. So at the end of this screening, we will have a treatment recommendation report for the patient. It could be single drugs, it could be combination drugs, but usually we give a recommendation report that does combination therapies. And in these combination therapies are drugs that are not cancer, that are not specifically used for cancer treatment, so they are not cytotoxic. And that is important to the patient, and it also means they are easily accessible, you know, because many of these cancer drugs are not easily accessible to the patient. So everything that I've said is just this is just a pictorial representation of everything that I've said. We get the patient, we sequence the genome, we put the mutations that we got from the patient into the fly, then we screen all the FDA approved drugs on a large scale. That's over 2,000 drugs we screen, and then we narrow it down to the ones that are particularly useful to the patient. What do I mean particularly useful? The ones that rescue the phenotype of the tumor in the fly, which is essentially what will happen in the human too. Why? Because the tumor in the fly is genetically similar to what happens in the patient. So we can say that we are able to put up to 20 genetic alterations found in the patient tumor into the fly. So when we say we are capturing the entirety of the oncogenic map of the patient, that is what we mean. We can take up to 20. And usually cancer patients do not have that amount of mutations affecting their tumor up to 20. Most of them don't have up to 20. So we have more than enough space to accommodate this genetic variation in our engineered flies. So, and as I've said, the tumor the flies will develop is genetically similar to the patient tumor, because we got those genetic alterations from the whole genome sequencing that we did for the patient. And for each patient, we create, let's say, 400 to 500,000 avatars. And for every treatment, we do every treatment on approximately 300 animals. So at the end of the day, as I've said, many of the drug cocktails that we recommend contains non-cancer drugs, which means they are less cytotoxic. So I'm going to play us a video to that will recapture everything that I've said on the Vivan Therapeutic PDP process. And can we all see the video? Is it playing over there?
No, it is not praying.
Not yet.
Not yet,
Oh,
not yet.
we can hear the voice, but I'm
No?
not seeing pictures. Yes, yes.
You can only
It
hear
is
the
just the
background
voice.
voice.
Yes.
Ah, that's not really nice. Can you play the video, please, from your side?
Okay.
Um,
I'm talking to the admin
okay, okay.
because the video is pretty nice and I want everyone to be able to see it. So I'm going to try to share it again and you tell me if you can see or not. Can you?
I can try it and we'll see. Let me try to share it.
No
I'm on the
worries.
slide already. I'm on the slide already.
Okay, try. Thank you. It's a nice video that gives a very good recap of everything that I've said about the PDP process, so that we can have a visual representation of what the process looks like.
Okay, can we see my screen, please?
Yes.
Yes, let's see. So why is
If
yours
you or
playing
someone you
and
love is
mine is
facing
not?
cancer, you'll know that every day is a battle. You fight to be seen, to
Can
stay
everyone
positive,
see?
while your
Yes.
body is a
Yes.
Okay,
battleground
thank
and
you.
victory far from guaranteed. Think of cancer not as a single enemy, but a collection of opponents. Treatment may be effective in defeating some of those opponents, but not all, which get a chance to strengthen and grow. However, there's a new reason to be hopeful.
The personal discovery process is a revolutionary method to help you fight cancer.
We look at the whole cancer and devise a personalized therapy that will attack it on multiple fronts. We start with a full sequencing of your cancer, including all mutations that might assist the cancer and make normal treatment less effective. We then build an army of fruit flies, into which we engineer the same cancer battleground as you face. 400,000 of them. We then run multiple massive clinical trials with this army, using all drugs that the FDA has made available to doctors. Through this, we can identify multiple safe and effective drug combinations that target your cancer intelligently. And a committee of medical professionals, including your oncologist, select the best for you. Everything we do revolves around you. We understand that when cancer is diagnosed, you want the best chance of success straight away. A treatment engineered to specifically address your cancer, developed by and licensed exclusively from Mount Sinai Medical Center, New York, employing technology funded by the USA National Institutes of Health and the American Cancer Society. And we bring the treatment to you, wherever you reside. So if you're fighting cancer, let us build your army.
Okay, so thank you. They had been, you see that the video is pretty self-explanatory. That's what we use Drosophila to do at Vivan Therapeutics. That's where I work. So Drosophila is, let me go back to my slide. Okay. Okay, so that's what we use Drosophila to do, as I was saying, at Vivan. So that's what we call the PDP process. But one thing, this is also another video, but I'm not going to play it because it's essentially the same, not the same video, but in this you can see the steps that we take, the equipment that we use, how we run the equipment out, because we've got some robotics that helps us to, because it's like a massive clinical trial for one patient, one at a time. So it's a lot of labor. So we have some automation that we use in the lab to help speed up this process. So this video would have shown you what those steps would look like. So I'm going to skip that video because it's essentially the same. So to round it up, the PDP process of Vivan Therapeutics eventually will culminate into something that we call too much. What does too much means? It's like a tumor match, because if you look at it, let's say we've got, can you see my slide?
Yes, it just appeared now.
Yes, yes.
Okay, into something that we call too much. You see, too much, it will be like something called tumor match. Like, okay, think about it. If we've got 500 patients waiting to be screened, the capacity to do that, it's enormous, because this process of PDP that I've described to you takes about 4 to 5 months. And if we are being sincere, we know that most patients with cancer, some of them do not have that kind of time. Their prognosis is not that great. So to mitigate this, the PDP process is being designed to culminate into this platform called To Match, where we would be able to match people's tumor with with treatment options that we have gotten from our PDP process. So let's say we've got patient one that we do whole genome sequencing. We got 5 genes that have been altered. We put this fly into the we put these genes into a fly, and it goes through the PDP process. And then we've got, let's say, 3 drug recommendations. Patient two comes around. Instead of 5 alterations in their genome, they've got like 3. So the drug recommendation that we gave patient one how feasible it is to say, okay, this patient that has come as patient 2 has got 3 genetic alterations instead of 5. Can we recommend 1? How will it be able to target the how effective will it be for this patient, since we didn't go through the whole process of uh, PDP pipeline for this new patient? So we are working on this, because it is impossible to continue to screen every patient that comes around. It takes a lot. So with AI and machine learning. Our machine learning and data science group are working hard on this, and we've got version 1, version 2. Eventually, I think the next version will be out for people to use. And for this too much, we are still welcoming investors, so we can talk about this later if anyone is much more interested in me explaining further how this goes. So these are some of the references that I've drawn this talk out from. I am very happy to have discussed this with you all. Thank you for your attention.
Thank you very much for the great presentation. It is indeed a pleasure to know how Drosophila can be used for precision medicine. And some of us didn't know like what is the real meaning of precision medicine. And now we got an insight on how it is, how it works, and different approaches that can be used, such as using Drosophila. Um, so I'd like to welcome people. I've seen some people online who were watching on YouTube around that 4. May I welcome them to just write their comments, their questions in the chat so that we can get to know what they are thinking. Also, those who are online here on this GT platform, they can just raise their hands and ask questions and give comments. Thank you very much. Audience, the floor is yours. Everyone is welcomed. Thank you. Madam Adedej, can you check if we have someone on YouTube who is asking a question or a comment?
Yes, there is a little bit of lag between what we are saying here and there, but they will soon catch on. So,
Let me check if I can access my YouTube on my mobile. Um, I'm seeing the
okay,
chat.
the questions that they post on the live stream, I'm going to post it in the chat here, so you should see it.
My questions. Okay. I lost that question. Can you read? I thought I saw one question now, but I can't see it anymore.
Yes,
It is in the chat.
it is in the chat. That's beside the share screen button.
Yeah, but it's not.
There's a question on the chat box. It
Okay.
says, my question is, how do we follow up with further discoveries and findings so we don't go back to business as usual?
Uh, I think that's what precision medicine is all about, no? Because if you see the advantages, the benefits of precision medicine, I don't think anyone will go back to business as usual when you see the enormous benefit that that this precision medicine offers, I don't think we will go back, because when you understand what is going on, when you understand what is going on in your genome, not the genome of everyone, just your unique, your unique you. I think you wouldn't want to go back to one size fit it all. If I get to know that using a particular drug is not beneficial to me, or is less beneficial to me because I've got some other mutations in other genes that will make this treatment less effective for me, why would I want to go back to using this generic drug when I have a drug that could work for me? I don't know if I'm communicating right. So no one will want to go back to how things were when they taste what precision medicine can do for them. And the second, I'm sorry, I don't know how to get. I could see chat and pose, but I can't see these
Okay,
questions
let me
anymore.
read it. Let me read it. I would like to ask, can the PDP process be employed in more cancer diagnosis?
Yes,
Can we use
yes.
the PDP process?
Yes, right now we are screening patients with colorectal cancer, but we are also able to screen patients with let's say salivary gland cancer. It depends on the patient, and it depends on the type of cancer, and it depends on the type of mutations that the patient have. If it is, because frankly, some of them, remember I said 70% of the disease causing genes in humans are present in the autolog is present in the fly. So some may not be, it may not be possible to model some, admittedly. So it depends on the genetic mutations and variations that we got from the whole genome sequencing. That's what tells us, that's what will lead us if this patient is qualifies for the PDP process or not. But yes, PDP process can be used for more than one type of cancer.
Thank you. Another one, what is the mechanism that Drosophila use in cancer treatment?
Hmm, I think that's what I've been trying to explain. That if what we do is to go back to the origin of the problem. Somebody has headache, somebody has something. It it depends on, okay, we may both present with the same thing, but the root cause of our problem might be different. So yes, it depends on what is causing this problem. So what Drosophila does, what we use Drosophila to do, is to go back to the origin of the problem, which is genes, the genetic alterations that will cause the tumors that we are talking about. So it is this root cause that we attack. So that's the
So,
mechanism that we use Drosophila to do. Drosophila is just recapitulating what we put into it, from what we got from your sequencing. So Drosophila is just recapitulating what's in there. What we put in there is what the fly is going to do. So we put everything that the patient has, that we got from the old genome sequencing, we put it into the fly, and the fly react because it's a whole organism model. So it just continues its life, and it's similar to what the patient will have, because that's the origin of the problem. So that's when we now start to screen the drug, to screen these avatars using the FDA approved drug. So it's impossible to screen human beings, but we can use flies to screen it. So we just, um, let's say, recapitulate the tumor in the fly, and we start to screen. So that's what we do. But if you want to understand, because these flies have different, these genes may be involved in different mechanisms, in different pathways. If that's what you want to discuss, then it's not suitable for this talk. We can talk about it later. If you are still interested, you can get in contact with me and we can discuss further.
okay, thank you. Another one, does the 5 months duration cover all the processes right from the genome sequencing?
Yes, yes,
Okay.
it does. For the
Okay.
simple model avatar, we call them avatar, so I'm used to. So for the simple avatar that has a simple plasmid, simple genes, yeah, 4 to 5 months start from the sequencing up to the drug treatment recommendation. Yes, 5 months.
Okay. Thank you. Then is the PDP only applicable to cancer treatment, or you can use for other diseases?
For now, that's what we use it to do. Maybe in the future, we will be able to adapt it to other diseases, but for now, that's what we use it to do. Cancer, different type of cancer, but specifically now colorectal cancer. But in the nearest future, who knows? Maybe we will adapt it to other um, diseases.
So there's another question. In this process of PDP, will it be applicable for patients having diabetes mellitus? Because during your explanation of PDP, it seems it's strictly related to cancer treatment. I'm a bit curious.
Ah, I think this question is similar to the previous one that I've answered. Now, what we use the PDP to do is personalized cancer treatment. Maybe in the nearest future, we will expand it to diabetes mellitus. Don't forget that this PDP process that we are using for cancer treatment is it's as a result of decades, years of research, clinical and academic research. So, in order to expand it to other diseases, diabetes mellitus, asthma, neurodegenerative diseases, other type of diseases, we will probably also need more research into that to be able to do it. But it's possible, I guess. It may be possible.
Thank you. There's another question. Is the PDP process applicable for all kinds of cancer?
As I've said, not exactly. It depends. It's a personalized process of discovery. So it depends on the cancer. I told you, depends on as I've explained, it depends on the cancer, the genes that are involved, the patient, everything taken into consideration before we'll be able to tell if this cancer can be modeled using our PDP process. It
I
depends.
think, okay, thank you very much. I think that is all for now.
Yeah, I guess so. But there's someone,
Yes,
she
there are
said she
still
has
some
any
questions.
question.
There are still some questions. Oh, okay. And the time is not on our side.
Yeah, sure.
Okay.
Yeah, I think this was a very interesting topics by just looking at the chat on YouTube. Like you've just found that it was a very, very interesting topics and how people are interested in asking questions. They are very curious. I hope that Doctor, you are going to make another presentation soon because I see there is people they really need to know more. They are very thirsty to get this knowledge about Drosophila and cancer things. So, with the sake of time, I would like to request Dr. Adeboega for a vote of thanks. Myself, I thank you for this great presentation. But let me welcome the special person to thank the whole team. Thank you. Dr. Tope, the floor is yours.
On behalf of the entire team, I would like to acknowledge our guest speaker for the education and insights. We have actually learned a lot, and we hope that the conversation will continue after this meeting. I also like to acknowledge the presence of all the participants. Together, we shall be able to take precision medicine using Drosophila to higher levels. Thank you.
Thank you very much, Dr. Tope. Now I think we are nearing closing this session, this webinar. Is the Mezero around so that he can
No,
give? So, madam, I can just
Yes,
give you the floor and you just close this session. Thank you.
yes, thank you very much. First of all, I will appreciate our lecturer, the guest speaker of today, Dr. Monsurah Gbadamosi from Vivan Therapeutics in London, UK. This is a wonderful presentation. You can see the comments of people from the YouTube. People really enjoyed this and they were fascinated knowing about the magic you can perform using Drosophila. Thank you very much for the insightful presentation. We are very grateful. We hope that another time that we call you, you'll be ready to answer our call. Thank you. Not only that, I will say a word of appreciation to the generals in charge of the institution that constitute the Install Africa, and at the same time, our noble guest on the YouTube channel, because without you, this program will not hold. It is because you are there that we are able to pass on this message. Thank you very much. We hope that next time that we call you, you will also respond. And my colleagues on the moderator platform, thank you for all your contribution, all the efforts we have been putting on here and here to ensure that Install Africa objective is achieved. Thank you. By next month, which is July 17, will be the next program, the next webinar on Install Africa. So stay tuned for another insightful moment. Thank you all for your support. Time for sparing the time to attend this webinar. Once again, I thank our noble lecturer, Dr. Monsurah Gbadamosi. Thank you very much. We appreciate your support. Despite your tight schedule, you squeeze time to be able to share your knowledge with us. Thank you.
Thank you for inviting me. So it's been my honor and pleasure, and I'm always available and happy to discuss the magic we do with Drosophila. I'm happy to discuss
Thank
flies
you.
anytime, any day. Thank you, and bye. Is it okay if
Bye.
I
Thank
exit
you.
now?
Yes, thank
Thank
you.
you very much, and all have a lovely day ahead.
And you too. Thank you. Over to you, Ms. Aksa.
Yeah, okay, thank you very much. I think the webinar is officially ended. Come to an end. Maybe we can just go back to our normal daily activities. See you in July. Thank you.
All right. Wish you a good day. Thank
You.
you all. Good night to you all. Thank you.